Hi, I'm Michelle Grazoulis, president of the Foundations at Rochester Regional Health, and I'm joined today by Dr. Carolyn Zyloney, a headache specialist at Rochester Regional Health. Dr. Zyloney, thank you so much for joining me today.
Oh, it's a pleasure to be here today.
This is my first time doing this with COVID, so I think it's your first time as well, right?
Yes.
So we'll get through this together, and hopefully we won't have any technical difficulties. So we're here today to talk about headaches, and as always, and I'm sure there are so many headache sufferers listening or watching, and if you have questions, please submit them, and I will periodically stop and see if there's any questions that might arise. But it's something that so many people experience, Dr. Zyloney, and although sometimes I know headaches can be life-threatening, sometimes they aren't. Most times headaches are not life-threatening, but they can be debilitating. As a lifelong migraine sufferer, I can appreciate how challenging they are. So I think it's a great opportunity for us to educate people on headaches, what we're doing at Rochester Regional Health to help treat, and what your work is all about. So let's start with a really basic question. Can you help us understand what's the difference between a headache and a migraine?
It's a great question. Most people will experience a headache at some point in their lives. But the term headache is sort of an umbrella term that encompasses a variety of conditions that cause painful symptoms in the head. The most common types of headache are tension type headaches and then migraine headaches. Other than that, there are a number of other primary headache disorders, and there are also a number of medical conditions that can cause headaches as a secondary effect of the illness. When people hear the term migraine, they often picture this really bad headache. What they don't always know is that migraine is actually a neurological disorder that causes head pain in addition to other symptoms such as light sensitivity, vision changes, nausea, and cognitive changes.
So is a migraine technically a headache or not?
A migraine is a type of headache. It's what we consider a primary headache disorder. So I like to think of headaches as first being grouped into primary headache disorders where the headache itself is the disorder versus secondary disorders such as when people have the flu, they'll also get a headache along with the flu, but it's not due to a headache disorder, it's due to the underlying illness.
Yeah. And sometimes medications and things that we're taking can cause headaches, and so there's lots of different reasons we can get one. What are some at-home treatment options? And especially today with COVID, I think it's really timely to be talking about what can people be doing at home to treat headaches and migraines?
So most people will use over-the-counter pain medications such as acetaminophen and ibuprofen. I know with COVID, a lot of people are nervous about using ibuprofen because of a study that came out saying that ibuprofen isn't necessarily safe. That study, I think, is not 100% proven. But in general, if you don't have an active COVID infection, it should be safe to continue using ibuprofen on an as-needed basis. These over-the-counter treatments can be very effective for some individuals. However, some people do end up taking them very often. And I usually find that if people are taking them 10, 15 or more times per month, they are at risk for a condition where the medication itself actually causes more headaches. We call this medication overuse headaches, or rebound headaches is another term for it.
Can I ask you a question related to that? I just want to clarify. So are medication overuse headaches caused by repeated use of things like acetaminophen or ibuprofen or naproxen sodium, or you're talking about other types of medication to treat migraines?
So acetaminophen, ibuprofen, the combination over-the-counter products, like the ones that contain caffeine along with acetaminophen or ibuprofen, as well as some of the prescription acute medications can all cause this medication overuse headache or rebound headaches. So
I didn't realize that.
Medicines can do that, yes. And a lot of people, I think, don't always realize that, and they will take things like acetaminophen and ibuprofen every day, not knowing that that could actually be contributing to their headache.
I didn't know that. That's really helpful. Thank you. Didn't mean to interrupt you, but I wanted to test for that.
Oh, no problem. So there's also a number of prescription medications that people can take as well, which we'll touch on later. But if the over-the-counter medications don't help people, they should talk to their doctor to see if there are other options for them. But for people with frequent headaches, there really isn't one quick fix. They can't just take some sort of medication and everything will get better. Optimal treatment really involves self-care, taking good care of yourself, getting good sleep, not skipping meals, eating healthy foods, drinking plenty of water, managing stress, and trying to identify and avoid any headache triggers, which could be things like certain foods, weather changes, and other things.
So when people come to you, is it typically because they've been struggling with headaches for a really long time and they're looking to understand, how to make them go away? And then I'm curious about how you get to diagnosing what's really, is it a headache? Is it a migraine? What is it?
So I think when most people come to me, it's for two reasons. One is that they have a brand new headache, like they were fine, and then all of a sudden, boom, they started getting these headaches and they want an answer. And the other most common reason is people who've had these headaches for a long time, maybe they're getting worse over time and they're really struggling, and they're looking not just for an answer, but also for something that will reduce their headaches, help them feel better. So when people come to see me, I really try to focus on the diagnosis as well as a treatment plan. Most people do end up actually receiving treatment from their primary care doctor for their headaches. And primary care doctors are very good at treating mild and infrequent headaches. But if the headaches become very frequent or are very disabling, or if people have odd, unusual symptoms with their headaches, they really should see a specialist like a neurologist or a headache specialist. So when people come to see me for evaluation of their headaches, the first step that I do is taking a really thorough history. So I'll ask them to describe their headaches in detail. I'll ask them to tell me about how many headaches they have in a normal week or month. And it's actually helpful if they keep some sort of a diary or a log of their headaches for a little while before the appointment. I'll also ask about prior tests they've gotten done, other specialists they've seen for their headaches, medications they've tried in the past and how they've worked for them, as well as family history of headaches, because certain headache disorders do run in families. And then I'll do a thorough exam, usually including an eye exam. This allows me to determine the most likely cause of the headaches. I'll also look for red flags, so unusual features that suggest that there might be an underlying illness or a more concerning cause for the headaches. But for most people that I see, the headaches end up being due to a primary headache disorder like migraine headaches.
So I'm curious also the advice that you would give to someone who's trying to determine whether or not there is something else in their life cause. For example, someone's taking a new medication and they end up with a headache that's that all of a sudden surprises them. When should you be concerned? If someone at home is listening and they say, well, I've had this headache for 3 days, when really do you say to someone, this is something that you should be concerned about?
So in terms of an acute headache, meaning someone who has a brand new headache, if it's a very severe headache, if they have neck stiffness or fever along with the headache, or if they have a change in their cognitive state where they're more lethargic, more confused, then I usually urge them to get emergent treatment, such as in an ER or in urgent care. If it's a long-term headache disorder where people have had these headaches for months or years, then I really ask people to ask themselves the following 4 questions. So 1, are the headaches interfering with their daily life? Is it stopping them from doing schoolwork, from doing their job, from doing family obligations or social obligations? 2 is, have the headaches changed over time? Are they becoming more frequent, more severe? 3 is, are they taking these over-the-counter pain medications quite often, or are they no longer effective? And 4 is, have they ever need to go to the emergency room for a headache? And if the answer to any of those questions is yes, they really should see a specialist like a neurologist or another headache specialist.
Okay, that's really helpful. I want to pause for a moment so that if someone just joined us, I can tell them who we're with today. I'm very happy to be joined by Dr. Carolyn Zyloney, who is a headache specialist at Rochester Regional Health and works in our neurology area. And we're talking today about headaches and migraines and treatment options. So I do want to talk about treating migraines. So I'm just going to hit on a couple of things that I know are out in the sort of public arena now and have been for years, but let's talk about Botox.
Yes.
Is it something that you recommend as a treatment for migraines?
So migraine treatment vary from patient to patient. There's no one universal method or one universal medication that works for all people. So when I come up with the treatment plan for migraines, I like to take into account each patient's preferences, their other medical conditions, the medications they've tried in the past, and come up with an individualized treatment plan. There's a large number of medications that we use for headache prevention. So options include several oral medications such as amitriptyline and topiramate, which can be very effective for some patients. There are potential side effects to these medications. Some people may experience side effects, others may not. I usually do start with an oral medication first, but for people who their headaches either don't respond to those medications or they can't tolerate them, then Botox is a potential option. Botox was approved in 2010 for chronic migraine, meaning people who have headaches on half the month or more, and at least some of their headaches are migraines. And I have had a lot of success with Botox for select patients. There are a number of other newer treatment options that have come out in the past few years that are also very effective as well.
So can you tell folks, and I'm also curious about this myself too, what does Botox do that helps alleviate or reduce a migraine? What anatomically happens when you use Botox?
That's a great question. Botox is a medication that blocks the release of certain transmitters from the nerve to the muscle. And by doing that, it relaxes the muscle. So it can relax muscle tension. And we also think that it works to interrupt a feedback loop between the nerves and the muscles and the nerves that go into the brain to reduce inflammatory proteins that are released by the nerve. So we're not 100% sure exactly how it works, but we have a number of thoughts in terms of that it helps relax muscles and helps reduce what we call nerve inflammation or nerve pain.
And that's probably why people say, oh, you have a headache, you just need to relax, right? Or that your migraines are caused from stress. And I know migraines can be caused from stress, but there are so many other factors that cause them as well. So that's helpful because I've always kind of been curious about what does Botox actually do? I know what it does to someone's face, so I assumed that the impact was very similar. What are some other treatment options that you mentioned? There's some newer treatment options. Talk a little bit about what you're seeing, what's interesting you right now. What are the things that are making you say, I think this could be a game changer?
Yes, so in the past few years, some new medications came out that are once a month injections that patients can actually do at home. They include arenumab, fremanezumab, and they are about equally successful to the other medications that I've used, but they have minimal side effects, which makes them advantageous for a lot of patients. And also it's something that can be done at home for many patients, which with Botox, people would have to come into the office to receive the injection. So a lot of people like the ability to get the treatments at home. There's also some new oral medications that have come out in the past few years that are currently available for acute treatment when people get a headache, but they may also be effective for prevention as well.
Mm-hmm. What's your perspective, Dr. Zyloney, about things like acupuncture, yoga, all those things that are sort of holistic ways of dealing with, maybe as a complementary solution to medication, but I'm curious about your perspective on that.
Well, I think that for headache treatment, we really need to come up with a comprehensive and holistic treatment plan that involves not just prescription medications, but considering vitamins and supplements, complementary medicine, as well as lifestyle changes. Yeah. So I often will tell patients about certain vitamins like magnesium that can help headaches. I also do recommend that people try things like acupuncture or massage therapy or biofeedback if they're interested. I also talk a lot about relaxation, mindfulness, and meditation, especially if stress is a major trigger. Those mindfulness and meditation exercises can really help people manage their stress, which could reduce headaches. And there's also a number of lifestyle changes that I counsel people on as well. Things like eating healthy, drinking plenty of water. So I do think that complementary medicine does have an important role to play in treatment of headache disorders.
Thank you. That's really helpful. It's such a mysterious kind of thing. I'm curious, what got you into this particular area of medicine?
I also suffer from headaches, and I know that they can be quite disabling. And I think that it's something that in the past, maybe there weren't as many treatment options. So a lot of people suffered. And my goal is to reduce suffering, because I really do believe that with the right treatment, people who are, for example, missing a lot of work because they're too sick to go in, if they're on the right medications and have the right treatment plan, they can go back to functioning, back to working, back to living their lives. And it can really improve someone's quality of life. And it's really rewarding for me to see people get better from their headaches.
Yeah, I can speak for myself. When they're gone, you feel like $1,000,000. Knock on wood, might have been gone for a really long time. So let's just stick with that. So I want to talk about COVID-19 for a moment, because I know we still have people suffering with migraines and needing to be seen. And I know that our headache clinic is a very, very, very busy practice all the time, in a busy area of the health system. So are you still seeing patients given the current circumstances? And if so, and I'm assuming you are, how do patients go about scheduling time with you?
Yes, we are definitely helping patients. I will usually encourage people to first talk to their primary care doctor, because sometimes there are relatively simple things that their primary care doctor can try. But if those supportive measures through their primary care doctor don't work, then they should see a specialist. So we are accepting new patients currently. You don't need a referral, but one is encouraged. And also, we are only doing telemedicine visits to protect people. We're trying to minimize people coming into the office because of COVID-19. So we're offering video visits through things like MyCare and other web-based platforms. So if people are interested in a visit, they can call our clinic at 585-723-7972 to request to schedule an appointment. And we are also using MyCare as our main platform for doing these visits. So we also encourage people to go to the RH MyCare app and download it. All people need to have a visit is a computer or smartphone with a camera or webcam and an internet connection.
Thank you. I was going to make sure we told people how to do that, because it can seem intimidating, but we're doing telehealth visits across the system in so many specialty areas. And I think it's great that people are still able to connect and get appointments and be seen and get treatment options. Before I wrap up, I want to also make sure that we take a moment to just talk about and kind of recap. But before I do that, is there anything that I didn't ask you that you think is really important to make sure that folks listening today are aware of, know about?
So I think one of the biggest questions I get from patients is that they think that if they have a very bad headache, that means that there's something seriously wrong in their head, like a brain tumor. And what I want to reassure people is that most often people with really bad headaches don't have a brain tumor. Brain tumors in themselves don't usually cause just headaches as their primary symptom. And the majority of people with headaches often have a primary headache disorder like migraines. So I would encourage people not to get very worried if they have these severe headaches. They should be treated, but it doesn't mean that they have a life-threatening illness most of the time. And in fact, most people with headaches don't even actually need to have any scans done or blood work done. I can usually diagnose the headaches through just a history and exam. So I'd encourage people who have really severe or bothersome or worrisome headaches to contact our office if they would like to get evaluated.
I think oftentimes that's what keeps people from going, because it's the fear of the unknown, and there's the anticipation of, oh my God, this is going to be something terribly tragic. And it's hard to imagine how much better you could feel if you weren't suffering from headaches.
Yes.
I always say to people, if you've never had a migraine, you can't appreciate how absolutely mind-blowing the pain is, and it just shuts you down. So I really, I so appreciate the work that you're doing.
Oh, thank you.
Oh, you're welcome. You're welcome. So just to recap, to make sure we set people off with the right information, if you're someone struggling with headaches, your advice was the first thing they should do is contact their primary care physician, correct?
That's correct.
And they'll provide a referral over, although it's not required, but it's suggested, a referral over, which I think is probably helpful because you end up having more information from the provider.
Exactly. So I'll usually look over the primary care's notes before I even see a patient, and then I'll see what medications they've tried, and I'll have a little bit better idea of what to ask them during the visit.
Okay. And then what I also heard you say is to remind people, number one, not all headaches most headaches are not anything terribly wrong, that it's something that can be treated with a combination of over-the-counter medication, sometimes prescription medication, and complementary medicine like acupuncture, yoga, stress reduction. I think you talked about this too, but food can be a real big trigger as well. So that's where you talked about a journal so that you can figure out what your triggers are.
Yes, exactly.
Yeah. Okay, so anything else that we didn't cover that you thought I should make sure I bring up?
I think we covered most of the important things. I do want people out there who are suffering from headaches to know that there is hope, and that hopefully with the right treatment plan, they can feel better.
Yeah, I agree. And I'm a testament to that. So I believe wholeheartedly in getting treated for migraines and headaches. I want to thank you so much for joining me today. Dr. Carolyn Zyloney, a headache specialist at Rochester Regional Health. It was fun doing my first virtual Facebook Live with you. I appreciate your patience. If you're listening and you had questions that we didn't answer, please feel free to email and we will get you answers. And Dr. Zyloney, I wish you safe travels during the COVID epidemic and look forward to seeing you again soon. Thanks for joining me.
Oh, thank you for having me.
Yeah, you too. Thanks so much.